Hi, this is Kal again for anesthesiacoach.com. The subject of this video is going to be the emergency drugs we keep in our dental office. Now here in Ontario, we're required to have 6 drugs that manage various common dental emergencies or emergencies that happen in a dental office. And there aren't a lot, and we're not really required to, completely run an ICU in a dental office, obviously, but we should be able to manage things and keep things under control to improve patient symptoms and welfare and the patient's health and well-being, so to speak, enough to discharge them successfully, or maintain the patient's health and well-being until help arrives. So in my hallway here in our dental office, we have a couple of things. The first thing we have is the sign. It says here that the emergency drugs are located here, a first aid kit and a defibrillator. Now in AED, defibrillator is not necessarily required in a dental office in Ontario, but we have one anyways. I do anesthesia, and it's not a bad idea to have one. We're in a retail setting outside, and we have even a medical office next door. I don't know how many of these locations near me have an AED, but they know that we have one. The signage is very important. It's important for the staff, even the patients, to know where these items are. So let's look at what we have here. First of all, we have an AED, an automated external defibrillator, and that's very useful, as we know. We'll talk about that later in the seminars that we give. The first aid kit is located here. There's a sign on the drawers. We have a simple first aid kit. The most common emergencies, so to speak, emergencies in a dental office are often those requiring first aid. I've had kids walk in and trip and scab their knee, and of course employees with paper cuts, that kind of thing. So these first aid kits are very useful. The number of bandages and so on. So everyone knows it's here, even when I'm not here. Everyone knows it's here. The other thing we have now are the actual emergency drugs. And what I've done is I've taken a toolbox, red toolbox from the Home Depot or Canadian Tire next door, and we've made that into our emergency kit holder. Now, everyone knows it's here, and all the drugs that are required fit in here except for the oxygen tank. So let's look a little more closely about what we have in here. We'll open this up. Ziploc bags, which each drug in them, and the medical emergency listed on the outside of the bag. So people don't have to wonder, what is this drug for? They go by the medical condition, in this case angina. And in angina we have the ASA aspirin and nitro. Asthmatic attack. In asthmatic attack, a mild attack, the puffer Ventolin, salbutamol, and in severe attack, the epinephrine. Allergic reaction. Again, a severe anaphylactic allergic reaction, we can deal with EpiPen, and we have the Benadryl. Not a required drug, but one of the most common medical emergencies in a dental office is diabetic emergencies. And we have some sugar here. Juice. And finally, the last drug, oxygen. A tank with a regulator and an ambu bag connected. The last and probably the most important of the drugs. For a full description of the drugs and how to use them, their properties and so on, look below on the website here, anesthesiacoach.com. You'll see the manuals which can be ordered, as well as our seminar lecture schedule, which during the seminar we go over everything here. We use the drugs, we even play with them. If you have any questions, please don't hesitate to email me at anesthesiacoach.com. My email's below. And we look forward to seeing you. Thank you.